Kuatsis aanotemish, kuatis tusiname tapu, kaita tawa hau etsit te, hau enatsif ka atsamos ka aus ka juitemish, tawa hau etsit te etsit stroa, kut onatsi etias si skautranis, kaita tawa hau etsit stroa jast. Tawa aanotemish kaya netsikana, etsita atsi sa wakchana, kaito kena katsa hatsi ni apesho tuma, kai kui me tsa mai kui kai tsa tsina ta atsi ku tsa kana video etwa wai tsi ku ni apen na sho tuma sa tsuma na tmu tai tsi au yu tse kai ku skuto ni masat so na hai tsi hima tsi at kai ku eme tsi stuya tsana tsi na ashkunish tsi tai aku tu Hey, it's a paar shutzi tru utranish untjuts. Mot to zi hiats in u ek anerftish. Ma me kai to zi kanashien zi kait. Amo me kai ki na hai shaiz shawape. Kai amo hatsa hat zi shahanutimish zi wapet zi hey amo kai zi owarsaku zi oyadze. Et kai tawa himasi tawa si outtarsi. Zatsi kai amo hei tauye si ma metsi kunatimu. Et taas aanatims kai me pa me yona pa shutsi trusa. Kai me si utsuto kai si pa jau atranita. Kua me si shaukchani mita hei si pa shut notrani shunish. Sa tu si kaus niau atra nish te otu manish. Tu hiatse. Kai tu ia. Eme etsi eko i tranat. Sa tsi hei kui ni otra kutru atu mano. Et himas shaiwet. Tawa tai tsi yogu te masrus. Ko hau na me to na tsi hiatse. Eko mas sin nishti tsi na. Nienai tsuma. Si kuyana waisi na etmotsi no anachku. Zatsi mesh to tsi hawe imi hano tsi ni oya tsi otamano, sti otamano. Imi amu mi hem hano. Mi eme tsi amu tsi oya tsi ko to ka aif tsi hano. Ko kai shu yu tsi tra kani tsi mi kawen int tsa ashti draman. Imi amu kai hawe tsi kaus tsi out. Ma meshwe. Tsi am kach tiam suni ewa tene. Naui atse amu kai kahana titim tsi oyatse. Amu kai hatsa hat onash si amur sekui. Seko. Show zatsi to emetsi eni ultras te otumano. Et show me yon emetsi nidra na hopa. Tawas naitra guni. Tahatsi ekus anatims. Kai shaiwana mati. Emetsi umasi shitranat. Utsa to kaitsi shitranat. Kuhawetsi shu ashkits amo. Show to me yona taatsi hopa noi amats. Himas ekranetsi kis wasanata. Taatsi yuku tem shus hopa. Ta kaiwa etsi to map tatsi no yu shatsanish netsi show ape. Kai minatsi enatsarsi ats. Taashiatsi. Good evening, my Acoma people. I hope that you are well today. I hope your families are well, your animals, your relatives, those who might not be living here, who live far away from us. I hope they are well. I wanted to say thank you, first of all, to everyone for your patience with the video. I know we had a lapse here in time. We've been very busy working on and with the federal government and state government to ensure that we receive from federal funding to help us during this time and to recover some of our costs that we've incurred during this time of this pandemic. And I want to thank you all for your patience and your cooperation. I know it's been tough. We're all feeling it. We're all frustrated. We're all anxious. But I want to say that thanks to all of you who have cooperated, who have followed the guidelines of the executive order, and who have cooperated with law enforcement and other security personnel during this time of closure and curfew, thanks to your efforts and your cooperation, things seem to be going very well. Of course, we have some individuals who maybe don't fully understand or didn't understand the intent of the executive order, but for the most part, many of you have and do, and it's really appreciated. We ask for your continued support as we move through this together, and I hope that in the coming days we'll be able to lift some of these mandates, including the stay-at-home, the closure and curfew. But for now, they remain in place, and like I said, hopefully in the next few days or in the coming weeks, we will be able to lift those and have a little more freedom to go about our day. But I want to inform you of a few things, and I've invited Ms. Tonya Lewis, who is our Executive Director of the Health and Human Services Department for the tribe, who is also the primary contact for the tribe with the New Mexico Department of Health. And she's going to be providing some information and some data for you. You know, unfortunately, the virus, as I indicated in my last video, has impacted some of our people. It was 6 people in the beginning, and with 3 of them who live off the reservation. But I'm happy to report that those individuals have made recovery, and they have done well and are resuming their lives. So I'm really grateful for that, and grateful to all of you for thinking about them and praying for them. And they will continue to recover in the days ahead. But we've also had some additional positive cases here at the Pueblo, and Ms. Tonya Lewis will share more about those and what's happening in terms of testing and what's happening in terms of what ACL's response to this and the support that we receive from ACL Hospital, the public health nurse, and others who come forward to assist our tribal members and others who are either test positive or those who might have had known contact with someone who had tested positive. So she will be on here shortly. But I just want to reassure all of the people that your tribal government is doing what we can. We have some good people working for us in the respective departments, and we have an excellent emergency response team who are trying to address every issue that is of concern during this time. And there are many. So rest assured that we are doing all that we can do within our capacity here to protect our people, to protect our land and our resources, and to ensure that our recovery after this all passes will be smooth, and that will allow us to reinstate our full organization operations as well as our business operations. But there's still a lot of work to do between now and then. And that's what my brothers on the tribal administration, the tribal council, our emergency response team, our executive directors, and others are all working very hard on your behalf so that we have a good transition once this all passes. And as we continue to deal with the impact of COVID-19 on our community. I want to also just say that we've had some really good collaboration with other partners, and many people have stepped up, have been very generous with their time and their money, and have contributed to the tribe by offering food and other supplies that we need. And we continue to ask for that support because we can't do this on our own with our own resources. And so I want you folks to know that we have had many people come forward, organizations and private individuals, who have stepped forward with funding or donations of food and other supplies that have been distributed to our programs, to our community members, our elders, and all of the communities. I believe as of last week, our tribal team had made deliveries of food to almost 600 households. And we hope to continue to do that and to offer and support your families with the food that we all need to nourish ourselves during this time. But for now, I want to end here and allow Tonya to say a few words. And I ask you that you pay close attention to the information that she's going to share, because it's all very important and will be useful to all of you as we deal with this health crisis and as we prepare for our reintroduction into a new way of doing things here at Acoma. So I'm going to turn it over to Tonya at this point. Thank you.
My name is Tonya Lewis, and I'm the Executive Director for the Health and Human Services Division here at the Pueblo of Acoma. The Health and Human Services Division and our tribal, state, and federal partners are working together with public health officials, healthcare providers, and the public to execute a comprehensive response to the COVID-19 pandemic to protect the health and the safety of our Acoma people. COVID-19 is a new disease, and daily we are learning about how it spreads and the severity of the illness it causes. With our Governor Vallo's most recent situational updates and the recent breaking issues, it has been shared the pandemic has continued to spread around the world, and unfortunately, closer and closer to our own community. Sadly, our ACL service unit reports that roughly 12 positive confirmed cases have impacted our community and our own Acoma people. Of those 12 cases, individuals are Acoma tribal members who reside on our pueblo. Additionally, the positive cases are being considered clusters, which means they are family units who live within the same household. It is important to note that HHSD, ACL Hospital, and our tribal government has a responsibility to ensure that we are safeguarding the protected health-related information of those we serve, including those who have tested positive. Therefore, we are not in the position to disclose the names of patients, but rather provide our community members with the number of positive cases, implement and encourage public health strategies to prevent the further spread of COVID-19. HHSD, along with our ACL partners and the New Mexico Department of Health, we are collectively organizing a community-wide drive-through testing this week. Please be on the lookout for a date, time, and location of this testing. Currently, ACL Hospital is offering testing, and if individuals do not have access to transportation, our Health and Wellness and Social Services departments can coordinate alternative testing sites along with the public health nurse. In addition, our ACL service unit has also been working tirelessly to formulate response teams, ensuring that our local hospital is prepared and responsive to the community needs. Our hospital is equipped with PPE, ventilators, has increased the number of hospital beds equipped to handle COVID-19 positive patients, as well as updated procedures for the morgue in the unfortunate event we have a COVID-19 related death. A range of ways that HHSD is supplementing the work that we typically conduct during normal times had been presently redeveloped with new support systems in place. This work is essential to ensure that the services are provided and the needs are met within the community. Across HHSD, each department has received some level of additional resources to continue to support our community members, such as added days to meal deliveries for our seniors, increase of meal requests, telehealth flexibility as mental health care is important during this stressful time, the work our health service providers who serve vulnerable youth and elders has been especially challenging during this time. However, we have found creative ways to continue to reach out to you all and to continue to provide services with safeguards for our protection as well as yours. HHSD is prepared to handle additional pandemic-related services such as the establishment and implementation of the Emergency Community Food Pantry, which will be up and running this week. The Community Food Pantry will soon be offering food care packages through a drive-through process. Please look out for additional details. We have also purchased modular trailer units prepared to host individuals and families who may need to quarantine locally. One important thing to understand and know is that of the 12 confirmed cases within our community, 2 of those individuals are currently being hospitalized. Others are quarantined at home, and 2 are soon to be released from quarantine and have had an exhausting yet full recovery. Understanding this and who we are as Acoma people, one trademark of Pueblo people is our resilience. I believe we've seen that strength shine through already. It's going to continue to take an all of Acoma approach to deal with this virus. This means continued close cooperation from all of us as we continue to face this tremendous battle right now. Our tribal organization has been mobilizing with a community protection team comprised of tribal administration, tribal council members, and our executive team, as well as other experts to assist in controlling the overall increase in positive cases so our healthcare system does not get overwhelmed by a large number of people who become ill at the same time. With that being said, I want to highlight the continued importance of social distancing, as social distancing is critical to our continued existence as Acoma people. The Centers for Disease Control described 2 cases involving family gatherings, a funeral and a birthday party, which resulted in 16 positive COVID-19 cases and 3 COVID-19 related deaths. COVID-19 has made life very disruptive, and events like funerals and birthday parties have been emotionally straining. But there's a reason to postpone those types of events during this time, because those types of events can lead to the further transmission of more positive cases. Additional recommendations are as follows. Maintaining good social distance. This means following the 6-foot recommendation, avoiding close contact with people who are sick, voluntary and recommended home quarantine practices which help to slow down the pandemic by reducing a community transmission from household to household. Use of face masks in community settings, as the face masks provide a physical barrier that prevents transmission. Take everyday preventative action, such as washing hands often and avoid touching face, nose, and eyes. Routinely cleaning and disinfecting surfaces and objects that are frequently touched, and consulting with your healthcare provider if you have symptoms related to COVID-19. And most importantly, please stay home if possible. Please also respect and adhere to the executive order issued by our Governor Vallo and tribal leadership. For additional support, our HHSD departments are available and can be reached at the following numbers: Social Services 505-552-5162, Behavioral Health Services 505-552-6661, Health and Wellness Department 505-552-5145, Senior Center 505-552-5175, and lastly, our food distribution at 505-552-5108. Thank you for your time. Please stay safe, be well, do not forget to wash your hands frequently, and I want to close with the following words.
Thank you, Tonya, for that information. I know that information is pretty heavy, huh? But it's the reality of what's happening throughout the country and throughout the world. And I think we're very fortunate that we've been able to keep our numbers very, very low in comparison to what's happening in other parts of the world and in other communities that are the size of ours. But we still have to be very careful and very cautious. You know, when we were contemplating the executive order, it was very difficult to arrive at some decisions, but it was also very easy at the same time because we knew that the only reason why we had to make these decisions, and the primary reason for this, was to protect our community, protect Acoma and all of our resources. I think my brothers on the tribal administration and I had to really do a lot of careful reflection also. I certainly did. And one of the teachings that I went back to, aside from thinking about what my great-grandfather, who I knew well, my paternal grandfather, Ben Vallo, and my Anawa Etemish, my uncles, my great uncles who are now passed, but also many leaders in our community who had a significant influence on my own upbringing and in my life, was to think about the advice that they've all shared with me over time. And 29 years ago, I reflect on that time a lot. Last year as governor and again this year. Because it was 29 years ago that I had served as tribal secretary and tribal first lieutenant governor for 3 years. And I learned a whole lot from many men, from many wise men. So when I reflect on the words of the late Governor Reginald Pascual, former Governor Lloyd Tortolita, who served as a lieutenant governor then, current Councilman Rex Salvador, who served as lieutenant governor during that time, councilmen like Augustine Seymour, Darwin Vallo Sr., Joe Aragon, Greg Ortiz, and many others, and many who were very influential on my life, including my late brother, Ron Charlie Yaainia. All these gentlemen, their collective wisdom and guidance, I rely on today. I try not to talk shop with my dad, also a former governor and councilman, but he's served his time, and I don't ever really talk to him about work. But I certainly am grateful that he continues to advise me. And I want to thank all of you community members who stepped up, who made the call, who sent the email, who sent the text to me and my brothers and members of the council, sharing your thoughts, your guidance, maybe your constructive criticism about what the actions that we've taken in this executive order to safeguard our community. I want you to know that your input has been very helpful and influential. I had a long conversation the other day with Darwin Vallo Sr., Guiuma. And he, as he always does, in a traditional setting at Acoma, and any time that I see him, he always advises me. He always gives me guidance. And I appreciate that. And during our conversation the other day, he was telling me about some of the things, his observations about the closure, about the security checkpoint. And then he also shared his own thoughts from his family who live away from home. But he was very helpful and provided me with some really useful information. And I thank him for that. So I want you to know, community, that it takes all of us, all those people I mentioned and others, many of you who have just called to say thank you, many of you who have called to say you appreciate whatever might have been done on your behalf during this time. That means a lot to us. And I want to say thank you to all of you. And I encourage you to continue to communicate with us. Many of you have, called and asked for assistance during this time of closure. And we've made exceptions. We've made a lot of exceptions for tribal members and non-tribal members. We're learning a lot about the community during this time, the needs of the community, and all the services that are offered by external resources to our elders, to those who are under doctor's care. Those are the priorities for us. And we also want to support all of you who continue to still work, who are essential employees, who are on the front lines outside, working outside the reservation. Those of you who commute every day. So we've taken those into consideration because we know that your livelihood is important. And we ask you for your continued cooperation. Please be respectful to the security guards and law enforcement personnel. Again, they are only there to provide safety for all of us and to ensure that we don't have anyone who doesn't need to be on the reservation coming in. So thank you again to all of you. We're working on some things here in the coming days that we will inform you of. We will also have Mr. Craig Vandiver, who is the Executive Director of Operations, that includes law enforcement, who will be providing a brief introduction and presentation for you via video. And we will let you know what's happening with the food pantry that we are establishing here, so that there's a local food source for everyone. And we are also going to provide more information about testing so that all of us can get tested, or as many of us that would need to be tested, especially frontline employees, elders, and others, can be tested. And then we'll also be providing you with information about what our strategy is for reopening in the coming weeks. So our Acoma Business Enterprises, our business board, the tribal council, the executive management team are all taking time also now to look at what does the reopening look like. It's not going to be the same when we close as when we closed. We will continue to take precautions to ensure that every employee is safe and the tribal community and others who come into our tribal buildings are safe. So we're going to have to switch things up a little bit. It's going to be a new normal of sorts in the beginning. But we hope that whatever we do, whatever the strategies that evolve during this planning process, continue to ensure that everyone is protected and safe. So in the meantime, take good care of each other, take good care of yourselves. And if you're not feeling well, if you feel like you have some of the symptoms, the number to call is right here. Call this number before going to ACL, before doing anything. Unless it's a dire emergency, call the 855-600-3453 number. You can explain to them what you're experiencing, and they will give you guidance on what to do next. If they tell you need to go to the doctor, they'll tell you that. If they tell you that you need to call 911, they will give you that direction. But please, take good care of yourselves. There are some families here who are under quarantine, who are self-isolated. Respect them and respect their privacy. And let's all wish for their recovery, quick recovery without any complications. And as we continue to live our lives right now under some stress, please let's be patient and cooperative, and let's be optimistic. It's a tough time. It's a tough time for all of us. But we can get through this. We'll get through it. Let's all concentrate on that we will all be together again. We will all be well and in good health. I want to end by just saying that my tribal administration and I and our tribal council are taking this very seriously. And we will be in closer contact in the days ahead. It might not be me or any of our tribal officials, but it will be others who work for us, who have firsthand information as well. We're also going to be informing you of upcoming primary elections, encouraging you to fill out your census forms. There might be some changes here as well. So we will be posting videos, check our social media, but we will also be distributing information at the checkpoint so everyone has the information that you need to know regarding these initiatives and upcoming events. So with that, my people, I say thank you for your time this evening, for your attention and your continued cooperation. Et show hopa me yona noi amats. Hopa rein is the amon almost tenen almost. The ars angetim si shatsante kutrus. Me yona baho and the seat to ostia at tawar konatani, stiars kama stil shapum. Zanye each extianish ba et a when the seat straight trashed hopa. The anotimutsi hopa amos frayat seekos angetimish. Pas ek no how it is tapu puchan it you to it and it hemet it anish. See straiwaya and it hopa. Ta to always shots, eko trostiatsi. Yash up Mahopa. Thank you.